The Cardinal Greenway is the longest rail trail in Indiana, 62 miles of paved trail from Meridian all the way down to Richmond. Back in 2019, the nonprofit organization that owns the trail studied its long-term maintenance needs, and they found that in order to repave every mile of the trail, it will cost $22 million. Now, the Cardinal Greenway is not publicly funded, but that number gives you some perspective on the local parks and trails that are publicly funded in just about every city and town. The initial construction of a park or trail is pretty expensive, while regular maintenance like mowing and mulching is less so. But finding the overall cost of these spaces is pretty straightforward. You just add up the cost of the construction plus the maintenance. The harder question is, what's the value these green spaces provide to the community? And how do we know if the investment is worth it? Health is Wealth is supported by Meridian Health Services and LifeStream Services.
People in the parks who are advocates for parks and recreational activities will talk about sort of ethereal benefits, health and well-being, things that are difficult to measure. Economists are specialists in measuring the hard to measure. So for 40 or 50 years, we've had the statistical tools, mapping, distance mapping, to get a good sense of a couple of things that are important. The first one of this would be just how much do people value the presence of this public infrastructure, say a park, a playground, a trail system that you walk or bike on like we have here in East Central Indiana.
The way an economist like Michael measures the value of something is figuring out how much people are willing to pay for it. In this context, are people willing to pay more to live close to a park or trail? So economists map out home prices. Essentially, how much do people want to move into a particular neighborhood? And they compare the home price to the distance from the nearest park or trail. They also make sure to control for all other variables like home size or school district, so they're comparing apples to apples.
On average, the distance to one of these trails, the closer you are, the higher the value of your home when you control for the characteristics of your home.
Michael said the results look kind of like an upside-down U shape. If you live right next to a park, maybe there's some noise or traffic that makes the home less desirable. But beyond that, the farther you go from this recreational infrastructure, the more the home value drops, because people want to live close to those places. It's common sense, but it's backed up by hard economic data.
I participated in a study a little over a decade ago where we were looking at the newly built trail system outside of Charleston and Huntington, West Virginia. And we looked at the opening of these trail systems that connected communities. And what we found is that if you were located in the census tract, which is a couple of neighborhoods along these trails, the opening of this trail system boosted your home value by about $10,000. So that was in 2005, 2006 dollars. So think about $18,000, $20,000 today.
This wasn't just one study. Michael said other studies done around the same time found very similar results. People are willing to pay thousands of dollars more to live close to recreational infrastructure, which results in higher tax revenues and more people moving to the community. And using the Cardinal Greenway as an example again, that increased home value has an especially big impact in the many small towns it passes through.
So think of Gaston and how much growth is beginning to happen in Gaston. My family routinely rides our bikes up to Gaston, spends money for breakfast there, and then bikes back to Muncie. This is an area that otherwise would have very little economic engines. That people are willing to live there, they're interested in living there, and that's what's driving most economic activity today. People find a place to live, and then businesses follow them.
Another example is found in new neighborhood developments. Michael told me it's become very common for developers to integrate a simple trail or a playground into the neighborhood. A local example of this is Storer Estates in Muncie, a new subdivision at the site of the former Storer Elementary School. Even before they broke ground on the first house, they installed a paved walking trail, a playground, and 2 lighted pickleball courts.
You don't even have to be an economist. You just have to watch what people are doing to understand that the reason they're doing it is because they're getting more out of the sale of those homes because they've built one less home in a neighborhood and built a playground, or because they use a buffer area around the neighborhood to incorporate a very simple mulch-covered walking trail that would benefit the new residents there.
So recreational infrastructure helps draw people to the neighborhoods around it, which increases home values and tax revenue, and also helps attract businesses to the community. With the high upfront cost of the initial construction, it's a long-term investment. But Michael says the research is clear. The economic benefits outweigh the costs, with an average break-even period of around 20 years. So that's how an economist measures the value these spaces provide to the community. Another way to measure it is how much do they help health outcomes in the community? Now, health benefits and economic benefits are related because a healthier population means lower health insurance costs for businesses and lower costs for government-provided health care, such as Medicare. But let's just focus on health outcomes right now. Does the evidence show that recreational infrastructure leads to better health outcomes? Well, maybe the first question is, if you build it, will people actually come use it? The Community Preventive Services Task Force asked that very question in 2021. They conducted a systematic review of 38 research studies looking at new or improved parks, trails, or greenways. And the findings were clear. There was a meaningful increase across the board in the number of people using the infrastructure. So if you build it, people will come. Other research looks specifically at how health outcomes are affected by proximity to green spaces. These studies are sort of like the economic studies we talked about earlier, but looking at the effects on health outcomes instead of home values. A review of 9 longitudinal studies found that the more green space a person had close to their home, the lower their risk of premature death. In other words, people who live close to parks and other green spaces live longer. Another review looking at 143 different studies found a few different interesting results. One was that exposure to green space led to statistically significant drops in cortisol, heart rate, blood pressure, and heart rate variability, which are all stress indicators in the body. More green space, lower stress. The review also found that people with lots of exposure to green space were 31% less likely to die during the study periods, 16% less likely to die from heart-related issues, and 28% less likely to develop type 2 diabetes. And the benefits extended to the next generation. Babies born to women living near green spaces were 13% less likely to be born prematurely and 19% less likely to be small for their gestational age. You probably already feel intuitively that being around nature is good for you. But lots of data shows this is objectively true. So as a community, we should be glad to pay for that Cardinal Greenway renovation, the new pickleball courts in Newcastle, a new skate park in Muncie, or updates to the disc golf course. The research clearly shows investments like these will pay for themselves, both financially and in better health outcomes in our community. Hey, let us know in the comments, what recreational infrastructure do you enjoy using? Is it the new skate park? Prairie Creek Reservoir? A local trail? Maybe it's a playground in your neighborhood. In the next episode of Health is Wealth, we'll learn about activity trackers. Do you really need a $400 Apple Watch when you can get a pedometer for $15? Thanks for watching. I'll see you next time.